Good morning. I haven't talked to y'all in a minute, but I wanted to get on here and quickly talk about a condition that I was pretty much talking about in my stories on IG and kind of piggyback off of that. There is this amazing creator that I deeply respect for sharing her experience and just being so transparent about the raw footage, feelings, and experience overall of what she has to deal with. I know a lot of people, deal with different skincare issues and, things from hyperpigmentation, dryness, oiliness, cyst, acne, abscesses. If you've ever had to have a cyst or an abscess drained, if you're on antibiotics, you kind of know the roller coaster of all of those things. And specifically with this creator, shout out to Sydney Carter for sharing her raw experience of what it feels like, what's her day-to-day life, what has she tried, what works, what doesn't. And I think it's super important that we kind of talk about it. I'm not giving any medical advice or anything, but I'm talking about what I see in practice as well as just, the experience that my patients share with me. And specifically with Sydney, she did share that she has hidradenitis suppurativa. So a long time ago, I had a friend question, how do you help the community? How do you truly help the community? And simply because I was in dermatology and I never felt the need to justify myself or my work or anything, because I knew life experiences were going to really just, show her what the real deal is, especially given that she was a social worker. But I think that people don't really realize what skin conditions, whether it's like severe hyperpigmentation, chronic, acne, or even, the aftermath of self-harm and how that influences people's, livelihood. Unless you've really experienced it, you can't really dismiss dermatology as like a vanity type of thing, because there's clear distinctions between cosmetic and medical, and they often overlap, especially with how, sometimes the insurance kind of dictates and our marketing kind of dictates what is deemed cosmetic versus medical. A lot of this also has to do with a mental aspect. I would say 30 to 45% of dermatology is psychodermatology. So for those who don't know, hidradenitis suppurativa is a chronic inflammatory condition that goes far beyond topical breakouts. So it causes a lot of skin irritation. You develop deep, painful nodules and abscesses around your sweat glands, so armpits, your groin, your bottom, and it ends up leaving these like tunnel-like tracks in the skin and boils and whatnot that erupt and go down, and they're constantly reoccurring and cyclical and flare up. And it could even prevent you from probably sitting on the toilet correctly, or just laying in bed and being comfortable. So it's not only a physically painful condition, but it's also mentally draining, really impacting people's daily living. And oftentimes people suffer in silence because it's misdiagnosed, it's dismissed, and it's messing up their quality of life. So I wanted to come on here and help you guys better understand that and how to advocate for yourself, look for early intervention, and have someone really support you in that process to getting clear and supporting yourself. I've seen firsthand in the hospital, prolonged hospital stays where I had a patient in the hospital for over a month. She was on around the clock antibiotics, had to have surgery and wound care constantly every day. And then also in the outpatient setting, I've had people, I'm helping support in navigating their long-term plans and battling whether it's this true diagnosis or not. But at the end of the day, we want to really trust people for what they're experiencing, especially because this is affected by the majority of this condition is seen in skin of color. And so there can be a stigma with it. There can be, people not being seen and heard, but I would recommend for you guys to find someone that advocate for yourself, one, and then find someone, if you're not getting the care you need, to really support you in that process. There is a great dermatological resource called the blackdermdirectory.com where you could find local physicians that specialize in skin of color and be able to help support you and treat that, as well as Black Girl Therapy is a great mental health resource to find someone that is in your state or local with you that has psychiatrists, that have, social workers, who have, therapists, counselors, things that you could really support your process in healing. So, the physical aspect, the mental aspect, the spiritual aspect, whatever it may be. But if you guys have any questions, please feel free to leave them below. But definitely look into this condition, and if it applies to you, share your experience. All right.